prostate changes when you masturbate. Have you ever wondered what actually happens inside your body every time you masturbate? Many men don't realize that their prostate undergoes significant changes, both in the short term and long term, after each ejaculation. Some of these changes offer health benefits, while others could become issues if not properly addressed. In this article, we will explore 6 key changes that the prostate experiences during masturbation. From blood flow and hormonal fluctuations to the long-term impact on prostate health, each of these factors plays a crucial role in your body's overall function over time. Understanding these effects can help you make better decisions about your habits and overall well-being. 1. The impact of ejaculation on prostate cancer risk. The prostate is an essential organ in the male reproductive system, responsible for producing seminal fluid and supporting reproduction. Over time, the prostate can accumulate waste and toxins, increasing the risk of inflammation and cancer. One of the most discussed topics is the relationship between ejaculation frequency and the risk of prostate cancer. Several studies have suggested that frequent ejaculation may help reduce the risk of prostate cancer. The primary mechanism behind this is the ability to flush out inflammatory agents and accumulated toxins from the prostate. When a man ejaculates, fluids within the prostate are expelled, reducing the likelihood of inflammation and limiting the buildup of harmful substances that may contribute to the development of cancerous cells. A study conducted by Harvard University, published in the journal European Urology, found that men who ejaculated at least 21 times per month had a lower risk of developing prostate cancer compared to those who ejaculated less frequently. This finding suggests that maintaining a regular sexual activity pattern could be beneficial for prostate health. However, it is essential to note that ejaculation alone is not the sole determinant of cancer risk. In reality, prostate cancer is a complex disease influenced by multiple factors. Besides ejaculation frequency, genetics play a crucial role in determining a person's risk. If there is a family history of prostate cancer, the likelihood of developing the disease is significantly higher. Additionally, diet has a major impact on prostate health. Research indicates that excessive consumption of saturated fats and red meat may increase the risk of prostate cancer, whereas a diet rich in vegetables, fruits, omega-3 fatty acids from fish, and nuts may help protect the prostate. Lycopene, an antioxidant found in tomatoes, has been shown to reduce prostate cancer risk when consumed regularly. Lifestyle choices are also an important factor. Individuals who exercise regularly, maintain a healthy weight, and manage stress effectively tend to have a lower risk of developing prostate cancer. On the other hand, obesity, a sedentary lifestyle, and chronic stress can increase susceptibility to the disease. Therefore, while frequent ejaculation may contribute positively to prostate health and potentially lower cancer risk, it is not the only factor to consider. To protect prostate health, men should adopt a holistic approach that includes maintaining a balanced diet, engaging in regular physical activity, managing stress, and undergoing routine medical checkups. 2. Temporary reduction of prostate congestion. The prostate is a small gland located below the bladder, playing a crucial role in the male reproductive system. It produces seminal fluid, which nourishes and transports sperm during ejaculation. However, over time, the prostate can accumulate excess fluid, leading to congestion, discomfort, and even inflammation. This is particularly common in men who do not ejaculate regularly or those with prostate-related conditions such as benign prostatic hyperplasia, BPH, or chronic prostatitis. One natural way to relieve prostate congestion is through ejaculation. When a man ejaculates, the prostate contracts and releases built-up fluid, helping to reduce internal pressure. This process, sometimes referred to as prostatic drainage, can alleviate mild discomfort and promote overall prostate health. For many men, this release brings a feeling of relief and relaxation. However, for individuals with conditions like BPH or chronic prostatitis, prolonged congestion can lead to more significant issues, including pelvic pain, frequent urination, and increased inflammation. In such cases, regular ejaculation may help manage symptoms by preventing fluid stagnation and reducing irritation. How prostatic congestion affects urinary and prostate health. When the prostate becomes congested, it can press against the urethra, leading to urinary difficulties such as a weak stream, increased urgency, or the sensation of incomplete emptying. This is especially problematic for men with BPH, a common condition where the prostate enlarges with age. By reducing congestion through ejaculation, some men experience temporary improvements in urinary flow and a decrease in discomfort. Similarly, men with chronic prostatitis, an ongoing inflammation of the prostate, often report pelvic pain, burning sensations, and an increased need to urinate. In some cases, stagnant prostate fluid can contribute to bacterial infections, worsening the condition. Regular ejaculation may assist in flushing out irritants and maintaining better prostate health. A real-life example. Consider Richard, a 72-year-old retiree who hadn't been sexually active for several months. He started experiencing mild pelvic discomfort and frequent nighttime urination. Concerned, he visited his doctor, who explained that his symptoms could be linked to prostate congestion. His physician recommended increasing ejaculation frequency as a natural way to relieve pressure and improve his symptoms. After following this advice, Richard noticed a significant reduction in discomfort and fewer trips to the bathroom at night. Important considerations. While ejaculation can help reduce temporary prostate congestion, it is not a cure for underlying conditions like BPH or chronic prostatitis. If symptoms persist despite regular ejaculation, it is essential to seek medical advice. In some cases, medications, dietary changes, or physical therapy may be necessary to manage prostate health effectively. Maintaining a balanced lifestyle is equally important. A diet rich in anti-inflammatory foods, regular physical activity, and proper hydration can all support a healthy prostate. Additionally, stress management techniques such as meditation or yoga can help prevent tension that may contribute to prostate discomfort. Final thoughts. Ejaculation is a natural and beneficial way to relieve temporary prostate congestion. For men experiencing mild discomfort due to fluid buildup, regular sexual activity may provide relief and support overall prostate function. However, for those with ongoing symptoms, consulting a healthcare provider is crucial to rule out more serious underlying issues. By staying informed and proactive about prostate health, men can take simple steps to improve their well-being and quality of life. 3. Hormonal changes, especially testosterone and DHT. Ejaculation has a direct but temporary impact on male hormones, particularly testosterone and dihydrotestosterone, DHT. After ejaculation, testosterone levels experience a brief dip before quickly returning to normal. This fluctuation is natural and does not lead to long-term hormonal imbalances in healthy individuals. One of the significant effects of regular ejaculation is its influence on DHT levels. DHT is a derivative of testosterone and plays a crucial role in prostate health. However, excessive DHT is linked to benign prostatic hyperplasia, BPH, a condition where the prostate enlarges and causes urinary difficulties. Studies suggest that frequent ejaculation may help regulate DHT levels, reducing the risk of prostate enlargement over time. That said, the frequency of ejaculation must be balanced. Too little ejaculation may lead to DHT accumulation, increasing the risk of prostate-related issues. On the other hand, excessive ejaculation might disrupt hormonal stability, potentially affecting energy levels, mood, and reproductive health. The key is maintaining a moderate and consistent pattern that aligns with the body's natural rhythm. Aside from its effects on DHT, testosterone fluctuations after ejaculation can also influence mood, motivation, and overall well-being. Some men report feeling temporarily relaxed or less aggressive after ejaculation, which may be linked to the body's hormonal response. However, testosterone levels typically recover within hours, ensuring that long-term masculinity and vitality are not compromised. In conclusion, ejaculation plays a role in hormonal balance, particularly in regulating testosterone and DHT. While moderate ejaculation can help maintain prostate health and prevent excessive DHT buildup, extremes in frequency, either too little or too much, may disrupt hormone stability. Finding a healthy balance is essential for long-term well-being and hormonal harmony. 4. Increased blood flow to the prostate. Sexual arousal triggers a series of physiological responses in the body, one of which is a significant increase in blood flow to the prostate. This occurs as part of the body's natural preparation for ejaculation, ensuring that the prostate receives the necessary oxygen and nutrients to support its function in producing seminal fluid. For most men, this surge in blood circulation is beneficial. It helps maintain prostate health by keeping the tissue well-nourished and functioning optimally. Improved blood flow can also contribute to better overall sexual function, as it supports erectile performance and sensation during intercourse or masturbation. However, in some cases, increased blood flow can lead to temporary swelling of the prostate, causing mild discomfort or a feeling of fullness in the pelvic area. This is particularly noticeable in men who already have underlying prostate conditions, such as benign prostatic hyperplasia, BPH, or chronic prostatitis. When the prostate is enlarged or inflamed, the additional blood flow during arousal may exacerbate symptoms like pelvic pressure, difficulty urinating, or lingering discomfort after ejaculation. Take the example of George, a 74-year-old man with mild prostate enlargement. He enjoyed an active sex life but started noticing a dull ache in his lower abdomen after ejaculation. At first, he ignored it, assuming it was a normal part of aging. However, as the discomfort became more persistent, he consulted his doctor. After a medical evaluation, he learned that the increased blood flow during arousal was temporarily inflaming his already enlarged prostate. His doctor reassured him that in moderation, sexual activity was still beneficial, but recommended hydration, dietary changes, and pelvic floor relaxation exercises to help minimize post-ejaculation discomfort. For most men, temporary prostate swelling due to increased blood flow is not a cause for concern. However, if discomfort persists, or if symptoms like urinary difficulty, pain, or pressure become more frequent, it could indicate an underlying issue that requires medical attention. Key takeaways. Sexual arousal increases blood flow to the prostate, which is generally beneficial for prostate health. Men with prostate enlargement or inflammation may experience temporary discomfort due to this increased circulation. If post-ejaculation discomfort is frequent or persistent, lifestyle adjustments such as hydration, dietary improvements, and relaxation techniques may help. Consulting a doctor is essential if symptoms become more severe or impact daily life. While masturbation and sexual activity support prostate health, being mindful of how your body responds can help prevent unnecessary discomfort and maintain long-term well-being. 5. Effects on urinary function. Ejaculation has a direct impact on the prostate and urinary system. During ejaculation, the prostate contracts to release seminal fluid, and afterward, it relaxes again. This natural process can temporarily affect urinary function, leading to sensations such as the urge to urinate or a weaker urine stream for a short period. For healthy men, these changes are usually mild and resolve quickly. In fact, regular ejaculation can contribute to better urinary health by keeping the prostate active and reducing fluid buildup that might otherwise contribute to irritation or congestion in the urinary tract. Some men even report better urinary flow with a balanced frequency of sexual activity. However, for those with benign prostatic hyperplasia, BPH, a common condition in older men where the prostate becomes enlarged, ejaculation can temporarily worsen urinary symptoms. Because an enlarged prostate already puts pressure on the urethra, the contractions and relaxation that occur during and after ejaculation can further disrupt urine flow, making it harder to urinate or increasing post-void dribbling. Some men with BPH also experience a stronger urge to urinate after sex, even if their bladder isn't full. How to manage ejaculation-related urinary issues. Stay hydrated. Drinking enough water helps flush the urinary tract and reduces irritation. Monitor frequency. Regular ejaculation may help improve prostate function, but excessive activity could cause temporary urinary discomfort. Practice bladder training. Strengthening pelvic floor muscles through exercises like Kegels can enhance urinary control. Consult a doctor if symptoms persist. If difficulty urinating, weak stream, or post-ejaculation discomfort becomes frequent, seeking medical advice is recommended. Conclusion. For most men, ejaculation has a positive or neutral effect on urinary function. However, in those with prostate enlargement, it may temporarily worsen urinary symptoms. Understanding how ejaculation interacts with the prostate can help men maintain better urinary health and manage any discomfort effectively. 6. Circulatory and cardiovascular benefits of sexual activity. Sexual activity, including ejaculation, offers several circulatory and heart health benefits. The physical exertion involved in sexual activity helps boost blood circulation, temporarily lower blood pressure, and reduce stress levels. This is particularly beneficial for overall vascular health, as improved circulation supports oxygen delivery to tissues and promotes cardiovascular efficiency. However, for individuals with pre-existing heart conditions, ejaculation and sexual activity should be approached with caution. The increased heart rate and blood pressure fluctuations that accompany arousal and orgasm can sometimes lead to dizziness, shortness of breath, or chest pain. These symptoms may indicate underlying cardiovascular issues that require medical attention. Additionally, erectile dysfunction, ED, is not just a sexual health concern, it can also serve as an early warning sign of circulatory problems. Since erections depend on proper blood flow, persistent ED may indicate narrowed or damaged blood vessels, which are also linked to a higher risk of heart disease and stroke. Men experiencing ongoing erectile difficulties should consider screening for cardiovascular issues. Managing sexual activity for heart health. Know your limits. Those with heart conditions should be mindful of symptoms like chest pain, dizziness, or fatigue after sex and consult a doctor if necessary. Maintain a healthy lifestyle. A balanced diet, regular exercise, and stress management contribute to better circulation and sexual health. Monitor erectile function. Persistent ED may signal an underlying cardiovascular issue that should be checked by a medical professional. Discuss with a doctor. If you have hypertension, heart disease, or take medications affecting blood pressure, seek medical advice on safe sexual activity. Conclusion. While sexual activity can provide cardiovascular benefits, individuals with heart concerns should pay attention to warning signs like dizziness or chest pain after ejaculation. Additionally, ED may indicate circulatory problems that require further evaluation. Maintaining overall heart health is key to both sexual and genital well-being. Conclusion: the role of ejaculation in overall health. Ejaculation plays a significant role in prostate health, hormone balance, urinary function, and blood circulation. Regular but moderate ejaculation can help maintain prostate function, support hormonal stability, and contribute to better urinary flow and circulation. However, both excessive and insufficient ejaculation may lead to potential health imbalances, emphasizing the importance of a balanced approach. Maintaining a healthy lifestyle, including a nutritious diet, regular exercise, and stress management, is crucial for supporting overall reproductive and cardiovascular health. Additionally, monitoring any unusual symptoms, such as chronic discomfort, urinary difficulties, or changes in sexual function, is essential for early detection of underlying health issues. If any persistent abnormalities arise, consulting a medical professional is highly recommended. Personalized advice from a healthcare provider ensures that concerns related to prostate health, hormonal levels, or circulatory function are addressed appropriately. By adopting a balanced and informed approach, individuals can optimize both their sexual health and overall well-being, ensuring a healthy and active lifestyle.